How do you know someone's deaf?
They can't hear. Cannot hear, I'm sorry, they cannot hear.
Well, so just like with vision loss or vision impairment, so hearing impairment, hearing loss, is it a safety issue?
Yes.
So manifestations are the following. So there's speech deterioration, fatigue, social withdrawal, or they'll ask you to, huh? What?
Yeah.
Okay. Or you'll hear them, the TV's way too loud, radio's way too loud. They always keep the phone on speaker and then they speak loud, right? Because they can't hear themselves. So they tend to speak louder. And there are effects there because what happens to relationships and their mental,
Can't understand like each other.
you know, let's say I see you guys talking, laughing, I can't hear what you're saying. What? Okay, I guess it promotes paranoia, right? Talking about me again. It causes conflict. So there's social isolation. It causes problems. Okay, it can ruin relationships. Again, my in-laws are perfect examples. Okay, my father-in-law's wholly deaf. He went through several hearing aids, never uses any of them because it's not sexy. Okay? Doesn't want to be seen with the. He prefers the small ones. But you know what happens to small ones? What happens to your ear pods?
They drop out.
Yeah, same thing. Okay? So he loses them, and then they're $1,500, $2,000. So hearing loss, let's start with prevention. So what let's look at the causes so that you know the ways to prevent. Congenital, we can't do anything about that. That's, you know, you're born with it or with family history. However, you can prevent recurrent ear infections, correct?
Yeah.
Okay. Or avoid the use of medications, ototoxic medications. So for those music lovers here, I don't know if you know how to regulate the volume. So the minimum noise level known to cause hearing loss is 85 to 90 decibels. Your phone can tell you anyway, right? Yes, Siri can do that, or your iPhones can do that. So industries at risk are the following. So anything with motors, you know, engines, power saws, or let's say you airplane mechanic, for instance, or in traffic, or you're a sound engineer, whatever your job is involving high frequency noise. Okay. So there should be ear protection. Simple as, you know, you mow lawns for a living, for instance. Let's say you have a business, you know, for landscaping. You do lawns. It's spring now, so it's, you know, business is picking up. Make sure you do ear protection. Or if you're a gun enthusiast, for instance, you know, at the shooting range, make sure you have ear protection. If presbyopia is the age-related vision loss, what do we call age-related hearing loss? Presbycusis. Presbycusis. It was presbyopia and vision loss. Let's look at first, because there are two types of hearing loss. There is conductive hearing loss, conductive hearing loss, and sensory neural hearing loss. It's not in this page, so we'll get to it in the next. Let's go to management. So how do you communicate with someone with hearing loss? So we had an identical chart under chapter 58. So this is the counterpart for hearing loss. So this is how you communicate. Do we shout?
No, you whisper low tone.
Do we hide in the shadows? Okay. Do you talk from the side?
No.
Okay, very good. So those are all mentioned here. Okay. Or if it's really bad, then use other alternative methods of communication. A Ouija board, the on your cell phones, text, whiteboard. A Ouija board will work, right? I mean, it has letters and numbers, right? Here again, for those, because they learn to lip read over time. So make sure they can see your mouth, your face is well lit. And again, announce yourself when you enter the room. You know what happened to me and Karma. Okay, let's go to the most common cause of conductive hearing loss. When we say conductive hearing loss, it's usually caused by an obstruction. Something is obstructing the sound waves, the airwaves from entering into the inner ear. Now, wax is the number one cause, especially in the elderly. Have you ever had it happen to you when something just fell out of your ear? A big ball of wax?
No.
Happened to me one time in college. I was just sitting and then something tickled down and then I looked at it, it was a big ball of wax. Just came off. Then after that, I could hear much better. Okay. Okay, so since the elderly are most affected here, so there are ways to get rid of earwax safely. So by safely, we mean Q-tips. Yeah? No Q-tips. Okay, should be either by ear irrigation, ear suction, or doctor has to go in and do it. Now, be careful about commercial products and then you have like an endoscopic camera. Those that have a phone app, then the cameras at the tip of the instrument and then allows you to go in. Please be careful of those. Those are not FDA approved. Okay. I mean, I use it, but it's not safe. Okay. For irrigation, ear irrigation, warm water, never cold or hot. Now, I'm sure you've played with ice water in your ear before as a kid. You did?
No.
We tried it because ice water.
Make your eyeballs move. That's kind of weird.
Yeah, involuntarily.
Oh.
It's crazy.
How did you guys discover that?
Well, my brother was a doctor and they did that to see whether or not someone is brain dead.
No, I do.
So they put ice water. And this is in Asia, okay? It's just in the third world. I mean, we don't do that here, but
In the front,
Yeah.
they must have kids. Yeah.
No, kids do it. They play on it.
Oh my God. No, I heard about this before. My coworker, his name is Milton, he's a doctor.
okay, anyway, so no ice water, okay? So it will be warm water for irrigation. Here are a few other options. Glycerin, mineral oil. Again, these are over-the-counter products. You heard about Debrox, right?
Mhm.
Yeah, Debrox is approved. The doctors prescribe Debrox, of course. Or I'm not sure. I think it's over-the-counter. Debrox. Foreign bodies can be lodged in the ear. I had an ant in my ear, living in my ear for about 12 hours. And then my brother took a bob pin and then took it out finally. He recovered it and then I tortured that damn thing. He was talking. I can hear everything he was saying. He was probably brushing off the wax off its face. Was up all night. And in the morning when my brother took it out, I tortured it for days. I kept it alive. Tore one limb, tore the antenna first and then kept it alive. And then the next day, another antenna. I wanted it to know what it did to me. We're not doing otitis. I'll leave this for peds.
Okay.
Okay, Meniere's disease. So this is on your blueprint. What is Meniere's? Abnormality in the inner ear. There are 3 sets of symptoms here. Vertigo is the most debilitating. There's also unilateral hearing loss and tinnitus. Now combine all 3. That's Meniere's. Okay, so you have, you know what ringing is, right?
Yeah.
Ringing, tinnitus, and then vertigo. You know what vertigo is? And you have unilateral hearing loss in the affected ear. Okay. So that's what Meniere's disease is. Look at the incidence. 10 to 12 of every 1,000 people have Meniere's. This is debilitating. This can cause you to be disabled. I mean, look at those 3 symptoms. Can you hold a job? Can you function as a nurse?
No.
Or whatever job?
Oh,
I mean, the vertigo alone,
that's it.
can you do anything? Yeah, you'll be bedbound. Okay, the nausea that comes with it. It's not just spinning. There's nausea, vomiting involved with that, and then you get dehydrated from that, right? Because plus when you're vomiting, can you drink? I mean, you're still nauseous, you can't drink. So it's really debilitating. So who gets affected? Both genders. And so here are the 3 symptoms: vertigo, tinnitus, and the hearing loss. When we say sensory neural, unlike conductive hearing loss, where it's caused by obstruction, this one is caused by damage to the auditory nerve. Again, accompanying the vertigo is severe nausea and vomiting. Plus, when you start vomiting, you get sweaty, right? So there's diaphoresis there as well. Let's go to management. So how do we treat patients with Meniere's? Symptomatic only. There's really no cure. So let's start with diet. So low sodium will help because remember it's mentioned here. I didn't read it, but it's caused by endolymphatic hydrops, meaning there's increased fluid buildup in the ear, okay, in the inner ear. So diet, of course, low sodium will help. Low sodium or low MSG. Can it help that there's no you stop smoking? Yeah, that'll help too. Let's start with sodium restriction. And here are the others. So not just salt, sugar as well. Eat fresh fruits, vegetables, whole grains, liquids, avoid caffeine, limit coffee, tea, and soft drinks. When you say soft drinks, what are these? Soda, which are high in sodium and sugar. Limit alcohol. I mentioned MSG earlier together with sodium. Since one of the treatments is a diuretic, make sure patients replace the potassium loss and avoid aspirin. What other over-the-counter drugs have aspirin? Pepto. Pepto contains aspirin. Who has Pepto-Bismol pink dresses here? You know what Pepto-Bismol pink is, right? Like a really bright pink.
Yeah, the color.
You have dresses colored like that?
Yeah. Oh, dress. No.
Pepto Pink.
So one of the teaching for this, what do you tell the patient to like if they bend down and they get in a rise program? Would that be one of the teachings?
Yeah, so we'll get to that when we go to nursing intervention. So yes, avoid sudden head movements, things like that. So let's go to the drugs. So drugs would be antihistamines, meclizine. You know Antivert, right? This is over the counter. Okay. So meclizine, same drug used for motion sickness, like Dramamine. Okay. They shorten the attack. Tranquilizers, of course, these are prescription. So you'll be given benzodiazepines to help control vertigo. And of course, the for nausea, vomiting. Now, why suppositories? Can you take anything by mouth? No, you're nauseous, so you'll just get, you're just gonna throw it up. For diuretic therapy, it's specific. Hydrochlorothiazide, triamterene, or spironolactone. Surgery is an option, but they don't really do this for all veneers. So we do these conservative treatment first before we undergo surgery. Again, I won't test this surgical procedure. What will we test? The pre and post-op. Okay, so let's go straight to that. Uh-oh. I remember. The surgical options is under one of these here. Because one of these is treated with surgery and it's there, like cataract. I think it's labyrinthectomy. There's no surgery here. Motion sickness is like vertigo. Okay, so regardless of the surgical procedure, whether it's myringotomy, labyrinthectomy, eustachian tube, replacement, whatever surgical procedure, is it a different ear that we're talking about? Same ear that they are manipulating. So therefore, care, pre and post-op care will be the same. Chart 59-7, page 1951. So antibiotics, just like eye surgery. What does blowing your nose do?
Causes pressure.
Okay, increases not only intraocular, intracranial, but also intra. Okay, it increases pressure as well. When you have to sneeze, because can we control the sneeze?
No.
Do so with your mouth open. So don't go wherein all the pressure goes here and then the pressure goes to the ears as well. So yeah, just be as loud as you can. Okay, sneeze with your mouth open. Yeah.
Does it increase your risk?
Well, all I can say is it increases intracranial pressure.
When you hold this.
So depending on your age. So yeah, I guess so. Let's say you have a aneurysm there, increases pressure. Yeah, you can pop an aneurysm. So yes, if you have underlying risk factors, but sneezing in itself, I don't think it'll cause a stroke. You have to have some vascular anomalies together with it. Lifting restriction is 10 pounds. And again, here, can we have sexual intercourse?
No.
Okay, so because that will also involve the straining, right? Because there's straining involved there. Yeah, or bending over. This is okay. The popping and cracking sensations are normal. So do you report this?
No,
Okay. Temporary hearing loss, is this reportable?
no, because it's.
Okay, again, normal. So
So
make
it's-
sure you know what to expect
Oh.
and what is
So
reportable.
everything is normal, you don't report it.
Oh, yeah, that's absolutely expected, right? So after surgery, there's usually a packing in the ear. So you report excessive or purulent drainage to the physician. And we get into the water.
No.
So just like the eye, so we avoid getting the operative eye wet. So this one, we also avoid the operative ear from getting wet. So can they shower or bathe?
No.
Shower.
Bathe.
Shower.
They could take off the shower head and.
You could shower and bathe. You can't wash your hair.
They can shower and bathe. The cue is not to get
Get your ear wet.
not get water into the ear. Yeah.
Here is like.
So here's the option. Let's say if you have to get into the shower, for instance, put a cotton ball saturated with petroleum jelly. Okay, to create an impermeable seal. Okay.
Okay.
So loosely packing it within the ear. Yeah, that's it.